Good afternoon. I'm Dr. Mark Smith, Chief Medical Officer for Henry Ford Allegiance Health here in Jackson, Michigan. I want to thank you for attending our media briefing on Facebook Live. Thank you for tuning in. Henry Ford Allegiance Health and the Jackson County Health Department are coordinating our messaging for our COVID-19 response and appreciate your attention today as we update you with our current situation. In order to ensure an efficient response to our media questions and support transparency, we want to make sure that we open up our Facebook Live, and we will have an email address for media questions to try to answer during our media briefing. We want to do this in real time, so please submit those questions and we will get to them at the end. We want to be sure that we are transparent with our information, hopefully getting you the most up-to-date information real time as it happens. As of 12 p.m. today, there are 6 positive cases of COVID-19 in Jackson County. 2 of those individuals are currently inpatient at Henry Ford Allegiance Health, one of them in fair condition, the other in critical condition. We have 3 patients recovering at home in good condition, and 1 patient has fully recovered and has been released by the health department. We currently have 14 persons of interest, which basically means that we are watching their symptoms and waiting for test results to come back from our various testing sites. Those patients are in the hospital. They are located in private rooms with isolation, and personal protective equipment is being used by staff and physicians taking care of those patients. I'll now introduce you to Dr. Hackert from Jackson County Health Department.
Hi, good afternoon. My name is Pamela Hackert, and in addition to being the medical director for Jackson County, I am also an occupational and preventive medicine physician here at Henry Ford Allegiance Health. I'd like to give you a little bit broader context and then go down to a little bit more specifics for you. And as of noon today, the number of COVID-19 cases in the state of Michigan is 1,809. Those numbers may not be reflected quite yet on the state's website. However, that will be updated at 2 o'clock today and is accurate. Our total number of cases for the county is 6 in Jackson. That also will be updated today. There are still 15 deaths statewide from COVID-19. And I'd like to go into a small amount of detail regarding the 5 additional cases that were reported as of yesterday. The first case is a man. He did not travel, but he does work in another county, and that county does have a fairly high incidence of cases. The second case had no travel, and she also works in another county, however. The third case is a woman here in Jackson County who does not report any travel outside of the county. The fourth case, sorry, I have 2 different numbers. One is reflecting that case who's already been released. So the 4th case, though, is a person who did travel outside of the state. He returned to Michigan with symptoms 2 days after his return, and when he had any symptoms at all, he completely self-isolated himself, so there was no potential exposure within our county. And then the last of the new cases is very new, and he is one of the hospitalized patients. We do not have any type of group exposure potential cases or contacts identified with that case yet. And then I've been asked to describe the tracing process for new cases and looking at potential exposure sites. And so, as I had mentioned last week, the way that we do it is our nurses take a very detailed history from the patient. If the patient's not able to do it, we take a detailed history from their closest relative. And in all but one of the cases, we've already identified that contacts and potential exposures were easy to identify. There were no activities that they did where they would have been potentially exposing the community as a whole. So their contacts have been notified with a phone call and are being followed up now by the health department. One of the cases we are still investigating and to whether or not there is a potential site that could be released to the public. When we determine that, we will definitely do that. And then it is important to keep in mind that the number of the confirmed positive cases cannot really be used to any way to estimate the actual number of people with COVID-19 in Jackson County. I know everyone has heard the analogy of this is the tip of the iceberg, and that is true. We just don't know how big of a tip of the iceberg is showing. So given the length of time it currently takes to receive lab reports, we advise anyone experiencing symptoms of COVID-19, and those include fever, dry cough, shortness of breath, severe headache. Some people are reporting now abdominal pain. Acts as though they have the infection in order to possibly avoid spreading this to others. Their household contacts at that time that they begin to experience symptoms should also stay at home in quarantine.
Okay, at this time, I'd like to introduce Cortland Katayan.
Good afternoon. My name is Cortland Katayan. I am the president and CEO of the Jackson Health Network. I'm also the vice president of population health here at Henry Ford Allegiance, and I'm the medical director for our occupational health program. I, like Dr. Hackert, am a preventive medicine and occupational medicine physician. So one of my primary responsibilities in this response has been the drive-through clinic and coordinating that effort. So most of my answers are going to be related to the role that's playing. The first thing I wanted to do was just reiterate what others have already mentioned, is that we really have limitations in terms of what our capacity is for testing. And so it's very important that we are prioritizing those tests for those individuals who are at the highest risk. And so we ask folks when they develop symptoms, if they develop symptoms, so fever, cough, shortness of breath, now there's people with abdominal pain, diarrhea, severe headache, that they really should isolate themselves in their homes, self-isolate for 14 days. They do not need to be tested. It doesn't change the outcome. It is something where they can, without that additional information, can self-isolate in their homes very safely. So that's the first thing we ask, is for folks to take that advice. The second piece of that is, if someone is isolating in their home with symptoms, that their contacts, people who are in their home with them, family members, et cetera, also should isolate for 14 days. And that's really going to be the best approach to help provide that limited exposure to others and limit the spread of this disease. So that's really the first two things I wanted to just reemphasize and highlight again. I wanted to talk a little bit about the numbers that we see at the drive-through clinic. We think that that's been going pretty well for the last week that we've had it open. Just yesterday's numbers through the clinic, we had 39 cars that drove through. We had 4 people that didn't qualify for testing and were just given education at the time. And then we had another 35 that were tested for COVID-19. So that was a total, again, of 39. And then of that 39, we actually tested our own employees as well, and we tested 9 of our own employees. Cumulatively, since the 14th, Saturday the 14th, when we opened the drive-through, we have tested, actually I'll start with the number of cars. We had 931 cars that have been processed through that drive-through site. 531 of those have been tested for COVID-19. 400 of those individuals that were not tested were just provided appropriate education on what the signs and symptoms were that would require them or that would make it appropriate for them to be tested. And then we've tested 29 of our own employees since opening the clinic for that same condition for COVID-19. So I think the natural question that follows is, okay, well, you've tested a lot of people. How many of those have been positive? And the reality is we've sent and coordinated with the county on reporting those, and Dr. Hackert has already presented those numbers. There are, though, delays in getting those results back. Most of the tests that are coming from our One Jackson Square site, that drive-through clinic, are being sent to external labs. Those external labs are the places where we were directed to send them initially at the beginning of this response, and they have been overwhelmed. There's a lot of demand for those testing sites across the country. This is true across the United States. There's a lot of folks that want results for these tests right now. As a result of that, initially we expected a 4 to 5 day turnaround on those testing times, and it's been 7 days or longer at this point. And that's true across the country. Everyone is experiencing a week plus on getting test results back for COVID-19 right now. As a result of that, it's important, again, that we prioritize those who are at the highest risk. So the drive-through site, we've made sure to really be specific on our questioning on the phone with our nurses to make sure that we're really just testing those at the very highest risk, because we want to make sure we're using those resources appropriately. And as a result of that, and that's actually both at the drive-through site and at the hospital. So we want to make sure that folks that need the test the most are getting the tests. We've had a number of calls from individuals that are looking for the results of their test. And so the mechanism for that is, as soon as we get the result back from the lab where we sent that test for processing, we will call you. We have nurses standing by that are ready to call you as soon as those tests becomes available. If you call us and we don't have the result, we don't have the result yet. So we will absolutely share it as soon as we have it available. Those of you who have access to MyChart, which is the online portal for Henry Ford Health System, your results will show up in there as well, as you can also see the results there. But keep in mind, we are experiencing delayed response times, so it could be 7 days or longer before a result does actually return. I did also want to just make clear again that the drive-through site is open. It is prioritizing individuals that are at highest risk, and that's a need to prioritize those who need the test the most, but wanted to make clear that that was the case. And then the last thing was just to emphasize there's also, as I mentioned before, the main treatment is that people need to stay at home isolated for 14 days. So Henry Ford Health System actually developed a self-assessment tool that's on the website. And so it's available at henryford.com/coronavirus. And individuals can go there and actually do their own self-assessment and then decide if they need to stay at home and isolate or not. So we encourage people to visit the website if they feel that they're having symptoms that warrant that. So with that, I'm going to like to turn back over to Dr. Smith.
Thank you, Dr. Catan and Dr. Hackert. Again, to clarify, from the media standpoint, we talked about testing, the challenges related to testing, and we are committed to reporting to you during these media briefings our positive results as well as our persons of interest results, and giving you an update of how those folks are doing, whether they're in the hospital or at home. We also want to make mention of the huge amount of community outpouring of effort related to our personal protective equipment efforts. And we want to thank you for that outpouring. We've been inundated with calls. We're referring some calls to the Henry Ford Innovation Institute, who is coordinating a system approach to preparing for personal protective equipment use in the case that we run out of our normal personal protective equipment. I want to assure you at this point in time, we have enough personal protective equipment that we use on a normal day-to-day basis for our staff and physicians as they take care of patients. We are preparing, however, for the need, should it arise, to use these personal protective equipment innovations that our teams have been working on. We have quality control concerns with our personal protective equipment that is being made, and so we have to test it, make sure from an infection prevention standpoint it meets standards. So we have limited at the current time to 2 processes. One, with our volunteers in the hospital making masks that we had shown you at a previous media briefing. We also have worked with a local partner, Technique Incorporated, to manufacture and produce surgical shields or face shields that are plastic and can be reused and not thrown away, and can be used by staff members multiple times. And as of today, this afternoon, we will have hundreds of those masks being shipped to us, and we can deploy them throughout the system. So we want to thank you for all those individuals involved in those processes, and thank you to the volunteers who are helping us put together surgical masks within the hospital. We want you to know, if you're interested in helping volunteer, that you contact our volunteer services line, and that number will be below. We would like to take any media questions at this point in time, and I don't think we have any that have been sent online. So we want to thank you for attending our media briefing. Remember, resources, you can check henryford.com COVID-19 Jackson website, as well as the henryford.com/coronavirus website, as Dr. Katayan said. We understand these are challenging times for all of us. We need to work together, we need to stay safe and support each other, and we will get through this. I want to thank our physicians and staff who continue to provide skilled care to our patients, not only our COVID patients, but patients that are attending and presenting themselves to the hospital on a normal basis that present in Jackson. I want you to know that we need to remain calm and positive throughout this, and we will continue to give media briefing updates in the future. Thank you.